All right, welcome back. In this week's Cancer Update, Dr. Ravi Patel of the Comprehensive Blood and Cancer Center is here, and he has some questions that a lot of people ask. Good morning to you.
Good morning.
We see the ads for it on TV. Palm Wonderful is one of the juice drinks and everything that's like that. Pomegranate has all these antioxidants, but is it really, the question is this morning, is it, actually we'll get to that one. I think that's going to come next. The first question we want to get to is exercise, because you say breast cancer patients often have questions about, with all the swelling they get from it, can they do things like weightlifting afterwards?
You know, it's interesting. Initially, people thought that it's not a good idea to do exercise, but then there was a scientific study done, and actually it benefits breast cancer patients. But the exercise should be gradual, and if they do gradual weightlifting, upper body exercises, it reduces the risk of what is called lymphedema, which occurs when you have lymph glands removed from under your arm. So the answer to the question, yes, it's a good idea for them to do exercise, and actually those who do exercise will do better than those who don't do exercise.
Gotcha. So
but it should be gradual.
Gradual. You want to pop a stitch, but it helps with the swelling. It helps reduce, kind of squeeze the fluids out of the area.
Yes, but not actively after surgery. Just when all the sutures are removed and everything like that. About 4 to 6 weeks after that, you can start it. Okay,
so gradual. Here's a question. I jumped the gun on this one. Does pomegranate really help in cancer treatment and prevention? There's a lot of ads out there saying it does. Does it?
Yes. You know, there were scientific studies done on that. The only clinical study done in patients showed that it delayed progression of prostate cancer. The way I look at it is that, you know, 8 ounces of pomegranate juice is definitely not going to harm you. And there's also preclinical evidence that in breast cancer, it prevents estrogen formation from other enzymes in the body.
Which helps reduce the
risk of breast cancer. Okay, so prevention, and if you have it, it's okay to take it.
Okay, juice is not a bad thing for you. Final, last question. Is it true that one treatment option for prostate cancer is wait and watch? Basically do nothing.
Do nothing, yes.
It seems like it kind of, like, I've got cancer, let's do something about it.
Yeah, exactly. There are certain cancers, lymphomas is another example where you don't sometimes do something. Prostate cancer, you know, sometimes people die with it rather than from it. And particularly older people, if they've got a very slow-growing prostate cancer, it's okay to watch it because it may take years for it to progress.
It's not super aggressive.
It's not super aggressive.
And so it may be better off because there's a lot of side effects from the treatment.
A lot of side effects from the treatment. Yeah. And the message is not don't take treatment, but in very selective small group of patients, it's a good choice.
Okay. Dr. Patel, as always, thank you so much. Comprehensive Blood and Cancer Center answering a lot of good questions this morning. As always, good to have you in this month.
Thank you.
All right, we'll take another quick break. We'll be right back.